what inspires me most about being a physician, actually probably started when I was a kid. I always liked helping people, even if it's like somebody skinned their knee in a neighborhood. So just always liked that aspect. And then as I got older, I realized that I really like teaching. Definitely did a lot of tutoring in college. And I've definitely brought that helping and caring aspect from growing up into my world as a physician. You need to make sure that just because you're treating a condition, it's not causing other problems. I've had multiple patients tell me that a doctor's never actually asked them why, what's going on, and what the cause was, because I've then realized that you don't want to just continue to treat a side effect of a medication with another medication, and then you're on 20 medications. Trying to kind of like loop back to the underlying cause as to what's going on ends up actually being more helpful and improving the patient's well-being. I really like behavioral health. I've developed kind of a following of people with mental health issues, and I feel like I do a really good job, and I've developed some relationships with a lot of like therapy providers in the area because of this too. I have friends in the partial program for Inspira's child and adolescent partial program, and they specifically refer patients to me because they know if they start medications and they stabilize somebody that I'm comfortable dealing with it after the fact and managing. But again, also realizing that it's not always just about medications. Getting therapy involved so that people develop coping mechanisms is so important. And that's kind of where it goes back to just talking to the patients and understanding where their triggers are, where their problems are, ends up being so important to treat them. What you can expect if you come to see me as a primary care doctor is a very caring person. Generally, I'm happy to sit and talk, listen, make sure I'm understanding where a patient's coming from. There are going to be times where somebody is having a hard day and they need more time. There are going to be times where you're not, and maybe you're just here because you have an ear infection, and it's simple and straightforward. And I feel like my approach in that regard, patients usually appreciate, and actually has them bringing their family members to me because they're like, she listens, and we like that in her.